Welcome to the Weiser Center for Prostate Cancer, a sanctuary for hope where you and your family can thrive, from diagnosis through treatment, with patient-centered care from our team of experts and the wisdom of advocates and former patients.
For men with prostate cancer, there are three main treatment management strategies: active surveillance, surgery, and radiation therapy. Depending on how aggressive an individual's prostate cancer really drives which of those strategies we recommend. For men who we are recommending treatment for, the only two treatments that we typically recommend are surgery or radiation therapy.
So for patients with the prostate cancer that's at the lowest end of the scale, and that's measured by factors we call Gleason score, which is how the prostate looks under the microscope. We look at PSA, and we look at stage, for example, how the MRI looks. And so for a patient with low-risk prostate cancer, almost universally the standard recommendation is something called active surveillance. And then as we go up that risk stratification scale to a category called intermediate risk or something called high-risk prostate cancer. These are prostate cancers that do, over the long haul, have a little bit more chance of spread of the cancer getting out of the prostate.
They may have treatment options that include surgery or radical prostatectomy, or they may include a treatment option that's radiation therapy.
So it's not uncommon that a patient comes to see me as one of the many experts here at the Rogel Cancer Center and the Weiser Center for Prostate Cancer, and seek my opinion as to what I think is best for them. My general approach has been, and still is, that first I provide the patient with as much information as I can about the different treatment options. I try to learn from the patient about what's important to them in terms of urinary function, sexual function, cancer control, their perspectives on health, wellness, risk, and having those same discussions, if at all possible, with their partner.
In order to do so, we use quality of life forms that fill out what's your urinary function, what's your bowel function, and what's your sexual function. So that gives us a baseline, that gives us understanding how the patient is before we see them. Then, in order to help a patient make a decision, myself as a radiation oncologist and a urologist who undergoes surgery for prostate cancer will go through the patient and understand both the logistics of treatment and also how those treatments might affect the bowel, the bladder, and the sexual function, both in the short term and in the long term after treatment. And so what we do is we work together. We try to figure out what the patient's perspective is, what their values are, what the focus is from their perspective, and then myself and the urologist get together and figure out what our perspective is, what we may think is the best treatment for them.
A very common question that we get is, which treatment is right for me? And I tell all men, in some sense, you can't make a wrong decision between surgery and radiation therapy. They are different logistically in side effect profile, but with modern treatments, most men do really well with either approach.
The challenge is that there is no one-size-fits-all.
There are some patients for whom radiation is better. There are some patients for whom surgery is better. And sometimes, frankly, they're both good options.
And so that answer is really, it's different for every patient, and it should be different for every patient because everybody comes to the clinic to see us and has different priorities in their lives.
And thankfully, often for prostate cancer, patients have time to make the decision that's right for them. If we're recommending either radiation therapy or a surgical operation for their prostate cancer, patients aren't under the gun. They don't need to make the decision right there in clinic. They can go home. They can read some materials in the comfort of their own home, ask their family members and friends whether it makes the right thing to do, make a set of pros and cons in front of them, and then they can get back to us what their right decision is for them or any additional questions they have for us.
When patients are ready to make a treatment decision between surgery and radiation therapy, the main things they typically consider are the logistics regarding the treatments and then the potential short-term and long-term side effect profiles. Surgery tends to just be a one-time surgery with either a same-day discharge or one-night stay in the hospital. Radiation therapy can be daily treatments, but really it's kind of weighing those logistics. There's some downtime that comes with surgery, where men who are receiving radiation therapy after each treatment usually feel well enough to even go to work afterwards.
There are a number of resources available to help patients and their loved ones learn more about prostate cancer, to learn more about the staging, grading, treatment options, what similar men have chosen in a similar situation and why, and what happened to them. We have some of those materials here at the Weiser Center for Prostate Cancer that we've developed with our team. And there's also materials available internationally and nationally.
The Prostate Cancer Foundation has an outstanding patient handout that talks about the differences in both logistics and side effect profiles for surgery and radiation therapy.
Also, the NCCN, National Comprehensive Cancer Network, has great educational material that patients can access. Learn about different recommendations and different paths that we would ask patients to explore depending on their health, depending on the prostate cancer risk, really the level of disease that that patient has.